honor to introduce our next speaker. And this is somebody I consider a leader in the kidney community. He's been a nephrologist for over 35 years. He has been somebody who has helped me when I have had difficulties. I went on home dialysis under the direction of Dr. Manassian. He's been a nephrologist for over 35 years. He's a board member of RSN, and he's going to talk to us today about cannabis and kidney disease. And since we can't get any pain meds anymore, I mean, that's pretty much your own option, I think. But welcome, Dr. Manassian, and I'm going to remove my spotlight and turn it over to you.
Today, our subject of cannabis is a little different for me. I've given a lot of talks, and scientific review of the literature always takes a long time, but there's really not a lot of science what we're going to talk about today when you add it all up. So we're going to be talking a lot about things that have potentials to be useful, and when we talk about them in their medical applications. But we'll go through, so we can look at the next slide, and this is what we're going to be going through today. Next slide. And this is the history and the relevance of cannabis and why it's a conversation for kidney patients, and why the scientific discussion has been difficult, and the different types of cannabis, the different effects, the methods of consumption, the durations of action with that, and the health risks of cannabis, the symptom burden that is common to kidney patients, and how cannabis might be a solution to some of those symptoms that kidney patients have, and the kidney and transplant considerations. Understanding how cannabis works is really getting into the science behind it, and the endocannabinoid system is what we're going to be talking about. And at the end, we'll give some time for questions, but just to proceed right in, let's go to the next slide. So cannabis has been around a long time. It was first reported in 1900 BC, so 4,000 years. And the Egyptians specifically were using cannabis for inflammation and glaucoma, something that we recognize today. The Indians used a mix of cannabis and milk and drank that as an analgesic, and it was a common analgesic substance in that 1000 BC time frame. So this has been around a long time. And CKD patients, we have problems with pain, nausea, anorexia, itching, which is the pruritus, and sleep disorders. And then when you think about what the potential benefits of cannabis might be, they address some of these problems here. And right now, when we talk about cannabis, it's already been legalized in 31 states. Whoa. So it's been legalized in 31 states, and cannabis is something that has been available in greater amounts to older patients. Oh, I lost it. Where is the presentation?
Can you see it?
No.
I can see it.
Yeah, let me go back in.
You may not be able to see it. He's on the thing. Can you spotlight Isola again? Let me get her on. Let me spotlight for everyone. And let me bring, can everybody see the presentation? And we are going to add a spotlight. All right, we're going to get started here. Everybody, can you see it, Dr. Manassian?
Yes.
Okay, leave it like that. Isola, you're just going to have to do miming at the same time.
Well, I don't know. Yeah, I think the problem is I got to turn my phone off. But
I think you got to, I know your phone. I've been out with you. You got too many patients calling you needing your help.
yeah.
So you're in demand. We love our nephrologists who are dedicated, and you're one of them.
Yeah, well, I'm not so smart. I don't even know how to turn my phone off. So I'm just doing that
You
now.
can sit
There we
on
go.
it.
It's
You
off.
can
Okay.
always sit on
There
it.
we
Look
go.
at-
I'm ready. So let's take it from this point. Well, I want to mention that the population that's using cannabis more is the older population. The most rapid growth is actually people over 65 years of age. Next slide. And why don't we know enough about scientifically about cannabis? Well, it's because of this. It's still a Schedule I controlled substance in the federal government's eye. So there's not a lot of scientific research being done because it's so restrictive, the regulation. But besides that, even if the regulations weren't there, it's a real challenging thing to study. Why? Because you got different ways of consuming it. It has different strains now. In the old days, when I was a kid, the 1980s, it was 3% THC content. Nowadays, the strains are growing or over 30% THC. So the substance is changing. They keep changing what it is that's in there. And there's a lot of other compounds besides THC and CBD that are in these drugs, in this substance. Next slide. So let's go to the next slide. The idea of cannabis is that there's many nicknames, marijuana being the most common. And so it comes from two kinds of plants, sativa and indica plants. And nowadays there's a lot of hybrids where they mix those two. And within the cannabis plant, there's over 500 chemical compounds, and 66 of those are called phytocannabinoids. See the word cannabinoid? Well, phyto is from the plant, and cannabinoid, well, cannabinoids turn out to be something your body has. And there are two main kind of phytocannabinoids in cannabis. One of them is THC, and the other is CBD. THC's technical name, delta-9 tetrahydrocannabinol. CBD is cannabidiol. I'm going to just use THC and CBD from now on. But what I want you to understand is that these plant-based cannabinoids are two things that are very similar and mimic what you have in your body, which is endocannabinoids. Endo meaning it's from your body, and another cannabinoid here. So the endocannabinoid system exists in your body, and that works in everyday functions all the time. So we have internal endocannabinoids, and there's two main ones of those. And then you have these phytocannabinoids, and they're called THC and CBD that come from plants. Now, THC is the thing that's psychoactive, gets you high. And CBD is not intoxicating and does not get you high, and is now legal in the United States. In 2018, in the Farm Act, they made hemp legal because it has almost no THC in it. And so their abuse potential for that, they realized was not there. And that's what CBD could be made from today. It could be made from cannabis, or it could be made from hemp. And CBD is completely legal and regulated now in all states. Go on, next slide. So cannabis, generally, when people talk about the kinds of cannabis, when they talk about sativa and indica, they're talking, or the hybrid, they're talking about different elements that they expect from those kinds of strains. The sativa is supposed to be energizing, makes you less anxious, and makes you feel productive and creative. Indica is more slams your body, puts you to sleep, very relaxing, reduces nausea and stimulates appetite more. And the hybrids, they make in between of those two strains, and they can also adjust CBD content, but your normal things that you're talking about that people consume, they have less than 1% CBD. They're 15 and up to over 30% THC nowadays. So the marijuana we talk about that we smoke, that has a high THC content, almost no CBD, and hemp is just the opposite, almost all CBD, no THC. And there's this concept you need to kind of take into account, which is part of the reason the science is fuzzy, and that's that there's over 500 compounds in here. There's 66 phytocannabinoids in here, and what temperature they go off at, whether you consume them by eating them versus by consuming them other ways, topically, they all have different interaction and all have different outcomes. So it's really a hard thing to study. Next slide. So what are the effects of THC? THC effect is euphoria, sedation, psychosis could be aggravated. So this is something that could be said is that people with pre-existing psychiatric problems may want to not be consumers of THC. Memory disturbance, decreased motor coordination, these are all things that you would consider maybe on the adverse side. Analgesia means putting pain to rest, so it's a pain control. Orthostatic hypotension means when you stand up, you pass out, your blood pressure drops. And this is something that is the #1 cause of hospitalization related to marijuana or to THC cannabis product. It's when people overdose on the edibles and then they stand up and they pass out and they end up in the emergency room for that reason. Tachycardia means your heart rate goes up, and increased appetite, we know this is called the munchies. And then as an antiemetic, it stops nausea and vomiting. So analgesia, pain management, increasing appetite, and stopping nausea and vomiting are the medical applications that we think of are the therapeutic effects. On the CBD side, we have euphoria, none. We have sedation, and just where THC causes psychosis, CBD is antipsychotic. Anxiolytic means reduces anxiety, reduces nausea, and it reduces inflammation. These are the medicinal things that we expect out of CBD products. Next slide. So how do you consume it matters, and how long it takes to have onset of effect and how long it'll last. So when we talk about inhaling these products, smoking is one way, vaping is another. When you vape, you heat the bud, the flower, to a temperature where it doesn't burn, but it vaporizes all the chemicals and you inhale the chemicals. The smoking is the problem of all of this. It's an irritant to the lungs. But you smoke flower, you smoke oil or wax, and its onset is immediate to minutes. It has a peak duration of 30 minutes, and it comes on and peaks at 30 minutes and has a duration of a few hours. Whereas when you eat cannabis product, you can get it in all these forms that I show here. The latest of which is you can buy little tubes of powder, and you can put that in your water, and that'll be the equivalent of like a beer. And they have all kinds of ways of delivering by ingesting. And the problem with the ingestion of cannabis products is very variable in the time of onset. And sometimes it takes a couple of hours before you feel anything. And by then some people have said, this is not doing anything. So they've taken an overdose and they keep redosing themselves. A common reason for ER visit. When you are taking consumables on an empty stomach, it has the slowest absorption. When you have fatty food in your stomach, it increases the absorption. And the effects can last many hours. And on the topicals, you can apply it to your skin, your hair, your nails. There's lotions, there's cream, and they generally start working right away, peak in about an hour, and those can last for hours as well. So this is how the duration of action is. Let's go to the next slide. So if you're looking for how do people consume, these are just various ways that people consume various kinds of edibles. The flower they put in bongs, they make pre-rolled joints out of this, and they have concentrates. CBD comes in gummies and tinctures and drops, and everything is available in every form, the topicals. Next slide. And if you just put in marijuana online in your Google search box, this is what comes up in my house, and they'll deliver to your house. And this is something that's just being done now everywhere all the time. Whether we have acknowledged it or not, it is happening. And it is happening in greater amounts in the older population, and the dialysis population, I think, is using these products. Go ahead, next slide. And this is kind of an example of what I was saying earlier, is this is what they sell, a bud, and they're talking to you about the price of it for 1/8 of an ounce, but it's 23.6% THC, less than 1% CBD. So the stuff that people buy to smoke like that, that's not going to give you any CBD effect. This is all THC. And these are just ways that you can buy it online, even. It was packaged in eighths and pre-rolled joints. Next slide. And there are the legal forms of cannabinoids. So there's a CBD that's used for pediatric seizure disorders, and there's what people recognize most as Marinol. And the indications for the legal, both from, these are cannabis derived, and the nabilone is a synthetic form, but they're used for chemotherapy-induced nausea and vomiting, and Marinol and Syndros are used for anorexia. So to promote appetite in people with HIV, chemotherapy, cancer, and I think in dialysis patients, people use it for that reason as well now. Next slide. So what are the risks of cannabis? There's the behavioral issues first. So yeah, it's impairing thinking, memory, alertness, and judgment. And think about patients driving their cars. This is where there might be a problem. It causes a distortion of perception of time, color, and sound. And there is an addiction potential. So cannabis is not without addiction. 1 out of 10 become addicted. And the sooner you start using, the younger the age of onset, the more likely for the addiction. Cannabis causes coordination problems. It increases appetite. And again, in the dialysis world or in the CKD world, you may think that that may make it more difficult to maintain your dietary restrictions. I want to point out that the brain is developing through 25 years of age, and it is believed that cannabis does affect brain function and development. And it is believed and reported that there could be a reduction in IQ when cannabis is used in earlier years of life. So I'm not recommending in any way anything today that you should do, but there's a few things I'm saying don't do. And one of them is to promote consumption of cannabis in people less than 25. The other thing is going to be never promote the use of synthetic cannabinoids that are sold like Spice and K2. So mental health problems, there's 3 things that you could say get worse with cannabis use: anxiety, panic disorders, and depression. And the anxiety is a frequent symptom of first-time use and high-dose use. And anybody in the family who has family history of mental illness, it's likely that these problems will be at an increased rate if you're using cannabis. And then there's something that goes through the thread of everything, and that's that cannabis use on its own doesn't seem to be a big problem, even in the transplant world. What is a problem is if the cannabis use is just part of a pattern of polysubstance abuse. So if you're somebody who's using cannabis in a minimal or regulated way, that's a different user than somebody who's using cannabis and takes opioids and takes this and that as well. So that's the population that transplant will not want to be transplanting. We'll talk about that later. Let's go to the next slide. So out of the behavioral side, let's say, what else can cannabis cause? Well, cannabis, by smoking it, is an irritant, and it is an irritant. It causes COPD and bronchitis, but there's not much report of any increase in lung cancer. But I think of COPD, bronchitis, that cannabis is like cigarettes in that sense. It causes lung disease and problems, but it does seem to cause less than tobacco. And on the side of the heart, the one thing that is known in the science is that when people who were smokers have a heart attack and they resume smoking after the heart attack, they have more complications. And that may be related to the fact that when you smoke, your heart rate goes up and your blood pressure goes up initially. So these things would put an increased demand on your heart. So this is one place where cannabis may have a problem, and it's not well studied, but they did find that one finding that was duplicated in more than one location, that if a smoker resumes smoking after a heart attack, they have more complications than if they didn't. When you talk about what it does to your intestinal tract, it slows it down, decreases the motility. So it may cause constipation at high doses. Personally, I've never heard of this complication. The immune system, it can act in variable ways, and we're going to talk more about your immune system when we talk about CBD. Reproduction, it lowers sperm count for males and the quality of the sperm. And there is a slight chance of drug interaction at high doses. And that's unpredictable again, because the contents of what you're consuming and the way you consume it is so variable. So that stuff has never really been well studied. But what I will say is drugs that are metabolized in your body are generally metabolized by your liver or your kidney, or they come out in the stool. And one of the things that we know about cannabis and endocannabinoids is that they are metabolized by the liver. So what does that mean? That means that you don't have a reduction in your endocannabinoids by dialysis. You don't remove it by dialysis. And it also means that if there is going to be any drug interaction, it's with the drugs that are highly metabolized by the liver. And there are a few of those. And we'll talk a little bit about that. But let's go to the next slide. Now, what is it that CKD patients have? Dialysis patients, chronic kidney patients, and how could cannabis be viewed as maybe an alternative? Well, first, let's start with pain. And I think this is important. 2/3 of dialysis patients or CKD patients in general have moderate to severe pain. And 60% of dialysis patients fill an opioid prescription every year. You guys have heard the opioid crisis. So what happens when you legalize marijuana and recreational use in a state? Well, 25% reduction in overdoses of opioids, and doctors write less opioid prescriptions. So there's some proof here. And the potential for safer management of pain using these types of products rather than opioids is raised. Second area, anorexia. We know that some problems with appetite, and it's already approved in cannabis products for HIV, cancer, chemotherapy, and anorexia nervosa. Whether or not there's a role for these things in patients who have kidney problems, I don't see why not, but it hasn't been approved technically, though I think some of our patients are, again, using these products for those reasons. Next slide. So here we go. Nausea and vomiting. Nausea and vomiting afflicts 18 to 28% of dialysis patients, 10% are vomiting. And THC is extremely effective against nausea and vomiting. It's not CBD so much, it's the THC that's a much more potent anti-nausea. Itch is also a problem. 40% of dialysis patients. Well, there's a limited amount of study, but it turns out the endocannabinoid system, of which the cannabinoid products are, the cannabis products are part of, that's the chemical modulator on the nerve that has involvement in the sensation of itching. And in a few small studies, giving patients different forms of cannabis was topically was useful in controlling itching. So there may be a potential here. Selected disorders, these are the sleeping disorders. So insomnia and sleep apnea, restless leg syndrome are common problems in our population. And it turns out that CBDs are favorable as a therapeutic agent for sleep. And we're going to go into some detail about CBD later. So let's move on. And what I was trying to say in the last slides were that there's theoretical reasons why cannabis might be useful in patients who have chronic kidney disease. So what do we know? In fact, well, it doesn't look like any kind of cannabis products are detrimental on the kidney in patients who are healthy. So if you're a healthy person, will in any way cannabis harm your kidney? There is no evidence of that, and there's been studied. And the attitude is the same regarding transplant recipients, that they are not at any risk if they have a nice functioning transplant. Utilizing these products won't put you at risk. And I'm going to provide you a couple of provisos there. There were reports of patients who had immunosuppressed states with transplant who got aspergillosis fungus in their lungs, who were smoking marijuana in older days. But in the newer world, everything I'm talking to you today about, you kind of have to divide into the fact that the newer world, we have legal products which have gone through good manufacturing, manufacturing product certification, and they've had to go through testing for pesticide, for heavy metals, and they've had to go through testing for other things like fungus that shouldn't be there if you got this from a reputable legal distributor. Most of the products consumed in California right now are still illegal products, however. And so you have to warn your patient, or as a patient, you need to be aware of this. So there were problems with fungus on pot in the older days, but you could get clean product now, if you're buying something from a certified manufacturer of the product, and the certification you're looking for is the GMP, Good Manufacturing Product label on it. And all products that are sold legally should show that they've been tested and that they passed testing. So with those two provisos, I talk about cannabinoids being something to consider. I think there's a lot of risk of the non-legal cannabinoids. The liver metabolized idea I told you before. So if the liver is metabolizing, no dose adjustment in the use of the products either when you have kidney failure. So that shouldn't last longer or less because you have kidney failure or because you went to dialysis. The two products that are synthetic products that are supposed to mimic cannabinoids that you would normally get out of a plant are called spice and K2. And these synthetic cannabinoids, they're always put on something. They're always mixed with something. And the problem is what they mix it with. And there were outbreaks of kidney failure because of the stuff that they were mixing these products with. So we would recommend avoidance of these products altogether. There's a rare syndrome, hyperemesis cannabinoid syndrome, and it usually only happens in really heavy users. But what happens in those people, they start to have nausea and vomiting, especially in the morning. They have some abdominal pain, they don't want to eat, and they get obsessed with taking hot showers because it relieves their symptoms. So that constellation of having poor appetite, nausea, and abdominal discomfort, that can be confused with uremia. And if your creatinine is 4 or 5 and your doctor thinks that you're now having problems related to poisons from the kidney toxins and starts you on dialysis, this is not going to make hyperemesis cannabinoid syndrome better. So just to recognize, it's not common, but if that is happening, that can be confused with somebody who needs to start dialysis and unnecessary initiation of dialysis. Next slide. And the cannabis and transplant. So the general comments are that there's no national or state policies and everybody's evaluating case by case. But for the most part, after contacting multiple facilities, I got that there's no automatic, you're using cannabis, you can't be a transplant list. There's a lot of centers that will discourage the use, and many will say, if you're using cannabis by smoking it, then I will not let you be on my list. So they do seem to tolerate edibles and topicals, but it's again a case by case. And the most important aspect of when they're screening a transplant patient for cannabis use is whether it's part of polysubstance abuse pattern. If they have a drug problem with not just cannabis, but they drink as well, or they're using other drugs, that's a problem. And if they have any kind of pre-existing psychiatric and now they're using cannabis on top, transplant centers consider that a problem and a reason maybe not to list you. And I will make comment that CBD at high dose can increase tacrolimus, and tacrolimus is programmed, one of the very, very common transplant medicines. And the other one in that family is cyclosporin. And cyclosporin actually reduces the metabolism of THC. So people who are using cyclosporin, they get a longer high out of their consumption of cannabis. Next slide. So I'm going to get into some detail now, and I hope I don't make you crazy, but I think it's kind of interesting to understand how does this stuff really work and why does it do what it does. So first of all, THC and CBD again are called the phytocannabinoids. And in your body, you have an endocannabinoid system. Just like you have a thyroid that affects all these different cells in your body, you have an endocannabinoid system, and it works in different places in your body. And you have receptors for this all over your body. And you normally have an endocannabinoid system that is getting stimulated by 2 endocannabinoids that your body makes themselves. And on top of that, now I'm talking to you about 2 external cannabinoids that come from plants, phytocannabinoids. And those are the THC and the CBD. And the THC is that euphoric part, and the CBD is more the medicinal part again. So you have an endocannabinoid system in your body, and what it works with is CB1 and CB2 receptors. CB1 and CB2 receptors are where these things bind and cause activity. And the CB1 receptors are found in your brain, in your gut, in your nerves, eyes, and in your blood vessels. And your blood vessels in your kidney in particular have a lot of blood vessels and have a lot of CB1 receptors. CB2 receptors are in your immune system, the white cells, lymph nodes, and your spleen. So two different kinds of receptors, and the different endocannabinoids, of which two come from your body primarily, and these two that we're talking about that come from these external cannabis products we're talking about. So there's a concept of counter-regulatory system that you should understand, is that each one does a different thing. And a lot of times one is turning on plus and the other one is turning on minus. So they try to balance each other. And I don't know if people are aware of that, but one of the things that's happening with COVID was that your immune system was getting turned on and it was going crazy. It was going on and nobody was regulating it, turning it down. So that's an imbalance in your immune system that has a negative consequence. And in your immune system, the endocannabinoid system could be imbalanced and cause problems. And one of the typical things that THC is known for is making more anxiety and psychosis, and CBD does just the opposite. So these things are counterbalancing in their functions in a lot of times. Next slide. So where do you have these endocannabinoid receptors, the CB1 receptors? Well, in the cerebral cortex of your brain. All of this on this slide is about your brain. So the brain has cerebral cortex CB1 receptors in high concentration, and so does your cerebellum. And it's found in your hypothalamus, medulla, and spinal cord. But what do these things do? Well, your brain and the cerebral cortex, that's your higher functions of thinking, judgment, memory, alertness, behavior, perceptions, where your cerebellum is coordination and movement. And now hypothalamus, appetite, appetite stimulation from the THC. So that's what Marinol does. Medulla. So here you control nausea and vomiting. And this is why THC is so powerful, because there's CB1 receptors in your brain and it turns off nausea and vomiting when you bind those receptors. And in the spinal cords and the nerves, it affects pain perception. So this is what's happening. You're taking in a substance that your body normally makes, and you have a lot of receptors for these things in your brain. And when you smoke a joint, when you eat an edible, what happens? It goes to those receptors and it does all these effects. Let's go to the, and I want to mention this. As a pain agent, CB1 receptors don't exist much in the lower brainstem. The lower brainstem is what controls respiration and cardiovascular function. And that's where there's a lot of opioid receptors. So when you overdose on an opioid for pain, you stop breathing. And that's why there's so many deaths from opioids. You can't do that with cannabinoids because there's no receptors down there. So people don't stop breathing if they overdose. They get other things wrong with them, hallucination usually, and nausea, vomiting, tachycardia, that kind of thing. Next slide. So the other receptors outside the brain, look at that. Eyes, what does it do? THC lowers intraocular pressure. The treatment of glaucoma. So glaucoma is treated by lowering the intraocular pressure. The Egyptians discovered that 3,000 years ago. Blood vessels it affects, and it increases your heart rate and your blood pressure. And I want to talk about blood vessels in much more detail when we talk about CBD. And then the gut, it reduces motility. So if you're somebody whose gut is always gurgling and hyperactive, people who use THC might find that it calms that down. Heavy THC use is reported to even cause constipation. And in the immune system, again, I'll get into that in the CBD conversation coming up. But here's where these things are working in your body and how they exert their effect is through these CB1 receptors. Let's go to the next slide. Now, why do we think CBD might work in CKD patients, people who have a problem with kidney disease? Well, here's the reason. Because the endocannabinoid system, it gets turned on when something is damaging your body. And those things that damage it could be anything. It could be drugs, it could be illness, it could be a chemotherapy drug they gave you, it could be an infection, it could be diabetes, but something happens. And then you get some negative consequence, pain, inflammation, nausea. Your endocannabinoid system gets turned on then. And what CBD has the potential to do is to reduce the things that cause inflammation and increase the things that are anti-inflammatory and decrease the scarring, which is fibrosis, and the changes that happen in blood vessels that are the result of the bad stimulation of those receptors. And in your blood vessels, if you get stimulation of these products, you could potentially be causing inflammation and scarring. And that is a very common problem in a lot of different disease states. And CBD itself is modulating your immune system. What do I mean by that? I mean that when you get an injury, your immune system comes running to that site of injury and says, hey, all these things I need to come over here to cause repair inflammatory things, I'm calling all you guys over here. And so the immune response is a recruitment of all other chemicals, a recruitment of other cell types. CBD affects that recruitment of other cell types. Next slide. So CBD receptors in the CB1 on the blood vessel can be considered bad guys because they cause fibrosis, they cause inflammation. Whereas the CB2 receptors, they're anti-fibrotic, anti-scarring, maybe the good guy. So in kidney disease, we know that we have an upregulation. We have more already in a CB1 receptor-rich blood vessel, the kidney. Kidney has lots of delicate blood vessels. So the CB1 receptors, there's more of them with more CB1 receptor activity in kidney patients. And the kidney patients who have more CB1 activity, they have more fibrosis, more damage going on than the ones that don't. So CB1 activity, if you want to stop inflammation, you want to turn off CB1 and you want to promote CB2. Next slide. And what do CBDs do? Well, they're involved here in this common pathway. So it doesn't matter what the cause was, but you're going to cause some vascular blood vessel damage. These causes could be diabetes, again, autoimmune diseases. When we talk about kidney disease, most of those things that are not diabetes and blood pressure that got people onto dialysis were autoimmune diseases where your body's attacking its own blood vessels. So anything, toxins, chemotherapy drug, all these things, I could have put blood pressure here. So when something injures your blood vessel, what happens? Injury happens, inflammation gets started, scarring occurs. It didn't matter how it started, but the fibrosis and the scarring is a common feature. So the kidney is very vascular and has a lot of delicate blood vessels that could be damaged in this kind of a process. And it is what's happening. Next slide. So the therapeutic potential of CBD is when these insults happen and causes damage, you're supposed to turn on the endocannabinoid system. And a lot of people have a dysfunction of the endocannabinoid system. So in our natural setting, a lot of people have endocannabinoid dysfunction. Just think about diabetes. A lot of people have glucose metabolism dysfunction. There's a problem in some people with this problem. And somehow, if this dysfunction is out of whack and you can rebalance it with CBD and again, reduce the inflammation, increase the anti-inflammation and the scarring, then maybe CBD's immune modulator function is something that will prove to be beneficial. So what did I just say? There's a good theoretical basis for why CBD might be useful in kidney disease. Now, let me step back and say a lot about it the other way. When you look at the theoretical things in science that should have helped people, when we studied them, a lot of them didn't help nobody. So theoretical and proving to be true are two different things. Is there a lot of downside here in using CBD? Not really. So that's the one reason I'm willing to mention all this, because I don't see a lot of downside. There isn't a proof that using CBD is going to help your kidney, but there's a theoretical basis to believe why it might. On the other hand, I want to mention that CBD products, though they're legal, are extremely variable in the marketplace. And in a big study in the country, only 31% of the CBD products actually had what they said they had in them. And a good number of them had THC product in it that wasn't supposed to be there. So even if you're buying a CBD in a CVS marketplace, a retail chain, you want to make sure that it has the right qualification, which is the good manufacturing process seal. If that was on there, then it means they're going to likely have the non-variability, and the actual product label will be correct. Next slide. So CBD dosing, let me see. So the CBD dosing, we have about a 6 to 12 hour effect. So when it's taken orally, it's usually taken twice a day. And if people are going to use CBD, one set of recommendations just starts with a simple start 15 milligrams twice a day and go up. And another says use this 1 milligram per every 10 pounds of body weight as a starting low dose. So if you're 150 pounds, it would be, again, 15 milligrams. So these are the ideas. You might be going up to 150 milligrams if you're using a high dose. But if you're trying to treat a disease state, you probably need to get at least to 60 milligrams to make an impact. So I think this is something that is just for your information to know that there are some guidelines on this. And next slide. And I want to just again reiterate that there's not a lot of science, that everybody reacts differently to these products because there's such a difference in every product. And that in general, if you're going to use any of these products, you should start with the lowest dose and gradually increase as you understand how your body reacts. And if you're using unregulated products, you're taking great risk in having contaminants in there, and you're getting variable amounts of whatever is in there that you can't be relied upon. And avoid the synthetic products, K2 and spice altogether. Realize that there is this potential for addiction. And I want to say that the may, when I say CBD may have benefits, it may have, but it's not proven. And there are minimal risks, I believe. And the concepts, the theoretical background for why they may be useful, there's a theoretical role here. Again, until it's proven, it's not proven. And medicinal cannabinoids, as well as recreational cannabis, is out there. It's already in our midst. And understanding how we use them and what the risks are was the hope I had today. So with that, I'll just stop there and leave it to questions.
Thank you, Dr. Manassian. I think there were, you answered most of the questions during the presentation, but is there a difference between oil and creams? Somebody asked that CBD oil to CBD cream. That was in the chat.
Yeah, because when you take CBD as a cream, it's going to not be systemically absorbed. So people use CBD creams as anti-inflammatory product, and it may take a long time to get the maximum benefit out of the topicals, up to 6 weeks. So if you're putting it on for arthritis, that's the case, that it's not going to get absorbed. It's not going to give you the systemic effect. It's going to be local to where you're topically applying it. And when you take it as an edible form, then you're going to get that effect throughout your body.
Well, thank you so much for this informative presentation. I have tried some gummies and some creams, and I think they are an effective way to treat problems. I mean, I have some arthritis and I use a pretty strong cream and it helps. So I encourage everybody, if you're having some kind of pain or something, to consider this. I'm not pushing, I'm not pushing cannabis, but I think it's a solution to some of our problems. So thank you for this very informative presentation, and I thank you for your time. And we'll see you around Glendale.
I appreciate it. Thank you. Bye-bye.
And a shout out to our corporate mission partners for making this happen.